Hi, it's Dr. Centeno, and today we're going to talk about what is the ITB and why does mine hurt all the time? Well, ITB stands for Iliotibial Band. And if you break that down into its two component parts, the ilio part refers to the ilium at the side of the hip, and the tibial part refers to the tibia at this side of the knee. So iliotibial band is just a band that goes all the way from the hip to the knee. And it looks something like this. So I've highlighted the ITB in red there, and I'm going to go ahead and get the pointer going. It's a band that actually on this side, on the hip side, connects in with some big muscles. The glute max muscle pulls this way on the band itself, and the TFL muscle pulls that way. So we have this band at the side of the hip that goes all the way to the knee, and these muscles yank on it. So what could that be for? Why is it there? Well, if you look at the biomechanics of this thing, it's really interesting because, as I just showed you, it goes all the way from the hip to the knee, so from the hip to the knee, and these muscles pull on it, both from the front and the back. And if you look at someone standing from the back, what happens when they raise the other leg? So when they raise the left leg, it's actually the muscles on the right and the side of the hip that support the pelvis, that keep that pelvis stable. So those muscles pull this way, and that yanks on here. And then obviously the foot is the anchor. So all of that provides a force couple, if you will, to keep the pelvis from tilting when you lift the other leg. Now, if these muscles here are weak, then the whole thing tilts when you lift the other leg because they don't have enough force to hold everything up. And that's a pretty important thing to understand if you have problems in the ITB. So if we were to look at the biomechanics here, again, just looking from the side, this thing goes all the way down from the hip to the knee. It's commonly painful right here at the side of the hip, but a lot of patients have pain that goes all the way down. Again, there are these big muscles that attach right here and yank on it that support the whole pelvis and hip when you lift the other leg. So if we draw on the ITB here, we can see that we have these big muscles on the side, and then we have the ITB going all the way from the hip to the knee. Now, what's really important is that there are nerves that actually supply those muscles, and those nerves that come from your lower back. And the nerve supply goes this way, and the nerves tell the muscle what to do. Now, if the nerves get irritated in your back, even though you might not have back pain or much back pain to speak of, or maybe you have a lot, who knows? But in either instance, if a nerve is irritated back in here, this muscle is going to have less nerve supply and the muscle is going to get weaker. And that's then going to wreak havoc, as you might begin to see. So if you look at the biomechanics of this thing, again, when you've got one leg lifted here, what ends up happening is the pelvis wants to obviously tilt down this direction, but it doesn't because this muscle contracts. Now, what would happen, again, is if this muscle over here was weak, because of nerves that were pinched in the back going to it, you're going to get the pelvis drop when you lift this leg. And you lift this leg a lot, obviously. You lift this leg when you run. You lift this leg when you walk. That's called stance phase. So basically what's going to happen is that this iliotibial band is going to get yanked on in that situation when the muscles on this right side are weak. So we're going to see pain along the iliotibial band. The iliotibial band wasn't built to withstand that kind of extra yanking force from the muscles being weak. In addition, as you can see here, if you've got a scoliotic curve in your spine, that's also going to shift and push the pelvis down on one side and up on the other side, which is also going to stretch out that iliotibial band and cause pain. So either a pinched nerve in the back or a change in the curvature, the side bending of the spine, scoliosis, can cause these issues. Also, if you're knock-kneed or bow-legged, you can experience very similar things. As you might imagine, in either one of these situations, you can get extra force placed on the iliotibial band. In addition, a lot of times patients will report a snapping iliotibial band at the side of the hip. And if you've got any extra force on the iliotibial band and this side of the hip area where it goes over what's called the greater trochanter gets swollen, it's going to snap. So that's what causes a snapping hip. So if your TFL hurts despite countless stretches, you may want to have someone take a look at your low back and whether a pinched nerve there may be making the butt and hip muscles weak. Again, don't necessarily have to have severe back pain to qualify to be in this category. Just subtle nerve issues that are causing weakness in the muscle, and it's showing up as a really pissed off iliotibial band. Well, thanks for watching. That's just a quick lesson about what the ITB is and what you might want to look at if you've got this problem. Thanks.